Introducing the revolutionary T-Stat VLS tissue oximeter from Spectros. T-Stat was the first device approved for the detection of ischemia, a condition of low or absent blood flow to tissue. Since 2004, T-Stat has remained the leader in tissue oximeter accuracy. The accuracy of T-Stat is unmatched because it uses broadband oximetry developed and patented by Spectros. Broadband means that T-Stat looks at over 260 wavelengths of light instead of the only 2 to 4 wavelengths used by other oximeters. The unmatched number of wavelengths allows T-Stat to accurately determine tissue saturation within the capillaries in a manner that is both reliable and reproducible. This is a difference you can see. T-Stat's broadband VLS sensors glow white, not red, to provide a high accuracy without calibration or adjustment. Healthy tissue typically has a tissue saturation value between 60 and 70%. The normal values for your patients may vary depending upon the type of tissue you are monitoring and the patient's medical condition. Because T-Stat is broadband, multiple independent studies have proven that T-Stat has significantly less error than other tissue oximeters. As a result, T-Stat values are remarkably consistent from patient to patient. T-Stat sensors can be moved or repositioned as required without compromising baseline accuracy. All T-Stat sensors are approved for up to 30 days of continuous use. You don't need to change them every day, as is required for some other sensors. There are multiple T-Stat sensors, each intended for a different clinical application. Here we see the T-Stat oral sensor, which monitors the buccal mucosa on the inside of the cheek. The oral sensor is used in the ICU and operating room to provide an oxygenation measure that corresponds to systemic perfusion and central venous saturation. The surface sensor is used on skin or other tissues for monitoring local perfusion. One use is during and after surgery to monitor surgical free tissue transfers during post-operative recovery. The surface sensor comes in 2 sizes, a 1 centimeter wide sensor and a larger 2.5 centimeter sensor. The 2.5 centimeter sensor is identical to the smaller sensor, save for a clear disc added to assist with stable placement on the skin. The endoscopic sensor is used in the instrument channel of an endoscope or trocar. This sensor monitors mucosal saturation during diagnostic or surgical procedures and is typically used during GI diagnostic procedures. Last, the 5mm catheter sensor is used for measuring tissues internally during open or endoscopic surgical procedures, such as during aortic aneurysm, stenting, or repair. The 5mm sensor may also be placed rectally to monitor colonic perfusion, such as during vascular surgery. In review, there are multiple T-Stat sensors, each intended for a different clinical application. To demonstrate the unmatched and rapid response of the T-Stat, we will block blood flow to a digit by squeezing the arteries running along the sides of each digit. When blocking arterial flow, tissue saturation drops rapidly over only a few seconds and rapidly falls into the abnormal range. Here, we have set the alarm limit at 35. When flow is returned, the saturation jumps and rapidly returns to normal. This is a simple and safe demonstration you can perform on yourself. Each T-Stat comes with a quick reference guide explaining powering on and off, basic operation, properly connecting, disconnecting, and troubleshooting Q&A. If you still have questions, you may check our information online at www.spectros.com or contact your Spectros representative. To contact Spectros directly, you may call 1-877-TSTAT-30 or send us an email at info@spectros.com. Thank you for your interest in the revolutionary broadband T-Stat tissue oximeter from Spectros.